Great to see you today. Thank you for coming to Be the Change. I'm Jisoo. I'm a member of our YAC, and I want to introduce you to today's workshop led by Joey, Rakil, and Muntaha. We're going to be discussing the ways how national and state policy have transformed in the past decade and we're going to talk about their impact on school-based health centers. And then we want to engage with you on how we can talk about change. We want to talk about strategies on how we can make an impact on changing those things. And yeah, I'm really excited. It's really great to see you guys.
Okay, perfect. I'm gonna share my screen. Let me know if this doesn't work. Okay, you can see, can you guys still see my screen and the slideshow? Okay, that's great. Okay, so first of all, we're gonna introduce ourselves. So go ahead.
Hi guys, I'm Sahana. I'm a senior at William Mason High School. This will be my first year of being on the School-Based Health Alliance National Council. I'm super passionate about global health and youth literacy, and a fun fact about me is that I love coffee and tea.
Hi, I'm Joey. I'm a sophomore at the University of Rochester. This is my third year on the Youth Advisory Council, and I'm majoring in chemistry and computer science, and I can play both the violin and the piano.
Hi everyone, my name is Muntaha. I'm an incoming senior at the University of Michigan. This is my second year on the Youth Advisory Council. I'm majoring in neuroscience. Um, I'm very passionate about grassroots health initiative, medical research and journalism, and I'm also ambidextrous, so I can write with both of my hands.
Hey everyone, I'm Rakil, incoming freshman at Stanford. This is my second year at the Youth Advisory Council. I'm passionate about public health, recently about healthcare antitrust, and fun fact, I'm an NBA fan.
Okay, so to give a quick to give a quick introduction of our topic, what is health policy and why is it really important, especially in the world of school-based health centers? So health policy is a collection of decisions, goals, and actions within public and private industries that make up the healthcare system. And it is a very powerful tool that can help the everyday person influence to incite foundational change. Some good examples are the funding that goes into school-based health centers, health insurance, pharmaceuticals, privacy and legal stuff like that. And so it's really crucial that everybody, especially youth, understand how health policy is impactful in their lives, critically surrounding school-based health centers.
So our presentation today has 4 objectives and goals in mind. So first of all, we want to track the state of status quo, state and federal healthcare. And then we also want to show you guys and help you guys learn how public health care policy runs and how SBHCs play into that as a novel solution. And we also want to help you guys learn more about how youth can get more involved in policy advocacy.
So now we're going to talk more about your guys' experiences. So since we have less people, I think we can do it in the main room probably. But we're going to discuss some healthcare issues in your area or locally that you've experienced or seen others struggle with. So if you have a personal example of healthcare issues that are in your area, feel free to take over the discussion. And then we also want to talk about what you wish your local government did about it, and if you saw any policies implemented regarding the issue at a local or a statewide scale.
And just as an example, I can start. So the first local issue that I think should be addressed, at least in my county, I'm from Georgia, is the issue of substance abuse. It's a pretty big issue that is kind of a lot of school administrators take it on in a silent fashion. They don't really address it. A lot of students know it exists, but they either think that it's normalized because everyone's doing it, or they just don't think it's a serious issue that should be addressed. So that's one issue locally that I think needs a lot more focus and support locally in my county. And one thing I wish my local government did is one, really reach out to youth and let them know how bad substance abuse is. As cliche as that sounds, there's not really a lot of awareness on substance abuse, at least in my county. And it's even if there is awareness, it's not really reaching school hallways where people are actually discussing those things. So trying to reinforce in a positive manner to stay clear from substance abuse is something that I wish my local government did, and hopefully integrate youth in that approach. So that's how I would answer that.
I can share an example that I've had too. So in my closer knit community, not in my entire city, but like there's a lot of people that have a lot of mistrust for the government. And this isn't necessarily like your stereotypical health policy situation, but it's definitely a scenario where policy and the government can make an impact. And so I think there's a lot of issues with how the healthcare system is mistrusted. And I think part of it is for good reason, but I definitely think the government could make a larger impact and make a larger effort to help remove this distrust and help bring back emphasis on the healthcare or science that's lacking in the specific that's lacking in a lot of communities. And so I think that for my community, at least, especially in the older populations, it's really important to me that people do that outreach, similar to what Rakeel was talking about, where the government makes the effort to reform those bonds of trust that used to exist between the healthcare system and citizens. And I think that that's something that could really be emphasized in my community. Go ahead, Jisoo.
Thanks, Joey. I wanted to give a positive example of change in policy. So in Oregon, we have quite a few school-based health centers, and I feel like we have a relatively strong community based around school-based healthcare. But in recent years, we have been struggling with funding due to inflation from the pandemic and increased financial strain on a lot of districts. And recently, HB 27, House Bill 27, was passed, which allowed for a major funding increase for a lot of these centers. And that means that they're better able to provide care and they're better able to meet families and communities' needs because they actually have the resources they require to actually provide those services effectively. And I'm really glad that that bill was passed. And yeah, it was really great to see advocacy for that bill go through.
A great example. Okay, I think if nobody else has anything to say, we can move on to the next slide.
So what you'll see throughout this presentation is you're going to see a lot of numbers. You saw some numbers before, but before we get into those numbers, we really want you to understand that behind those numbers are actual stories, so you don't get desensitized by bigger numbers. So next slide. So the first issue we want to address in terms of health policy is the issue of healthcare financial struggles. I think a lot of us know this issue where either individuals are unable to afford healthcare, health insurance, or simply can't pay medical bills. And as you see on screen are two specific stories. One from Alicia from Ohio, who her mother lost her battle to breast cancer because she couldn't afford her medical bills. And even after her death, they had thousands of dollars in medical bills that they still had to pay. Another example from Tina in Texas, where her grandmother died to cancer. And the issue was if she had insurance to pay for it and was actually detected later on, she could have survived. So it really shows that the issue of medical bills and lack of affordability in healthcare is not just a number on a piece of paper. It really causes struggle in families that are just unable to access healthcare. And it's a big reason it needs to be addressed. If people could have detected things such as cancer or chronic diseases or other illnesses and conditions that they suffered previously, if they had insurance or the right medical services early on, even as a child or as high schoolers, then they wouldn't have had those incidents occur later on. So hopefully these stories kind of give you an idea on the ground as to how people are struggling as a result of healthcare financial issues.
So so now we're going to look into the numbers that Rakeel was talking about and how health insurance is extremely volatile. The United States is one of the few first world countries that has a primarily privatized insurance or health insurance base, and so we see a lot. We see a much, as shown in this graph, we see a much higher pay per enrolled person for private insurance compared to Medicare and Medicaid, which are the government subsidized insurance forms. And so at the beginning, there was a legalization of Medicare and Medicaid under Title 19. And Medicaid has been serving about 83 million people, or 1 in 5 people, and Medicare has been serving about 65 million people. But recently, with the new Big Beautiful Bill's budget cuts, Medicaid is getting rolled back a lot. And I think, if I remember correctly, based off of current events, the Senate just passed the Big Beautiful Bill. And this means that after the House passes it again, I think, millions will lose health insurance coverage. And this is really important because especially communities that were originally being served by Medicaid, they're they face a lot of financial struggles. And with the lack of the government subsidizing them and the lack of the government's help, a lot of them will go without health insurance and therefore without health care. So it's really crucial that we look into how health policy is really affecting those that need health care the most and those that are unable to fund it. And so, especially now, it's really crucial to understand and learn and grow, and especially read into all these current events that are drastically affecting the health insurance world, I guess, of our politics.
So this is a story illustrating the dire consequences of substance abuse, especially amongst youth. So this is a story of someone anonymous in Connecticut. She grew up in a household where drugs and alcohol played a large role in her parents' lives. And so even though her parents did attend like Alcohol Anonymous and other programs, they failed to get sober consistently. So even though she told herself she never continued to use substances, when she got older, she began drinking. And this cycle only continued between the ages of 13 to 18. She continued to utilize substances, not just drugs, but alcohol as well. So it really illustrates that youth are affected by this issue at really high rates. And so oftentimes it's education and awareness campaigns that will take a preventative approach to youth utilizing the substances. Additionally, in this young person's story, they talk about how even though they were consistently drinking every weekend and using drugs every weekend, no one was identifying that something was going on with them. And so it illustrates that youth need to be more educated about how to spot the signs of substance abuse amongst their communities so they can get help for peers when necessary. And that's actually how her story ended up following through. When she was I think around 18, she ended up reaching out to a friend who was in recovery. And that was how she actually acquired help to get sober and see a therapist to alleviate her concerns with substance abuse. So at the end of the day, education and preventative care are necessary. But when push comes to shove, it ends up being the responsibility of peers to get help for youth who are affected by substance abuse. Awesome. So as you can see here, the prevalence of substance abuse has only continued to increase, but the prioritization of it at a statewide and federal level has gone down significantly. So at the federal level, but I think since 2015, there's been a 50% drop in funds for prevention programs. So that specifically comes through SAMHSA, which is the Substance Abuse and Mental Health Service Administration, which is like a federal organization dedicated to preventing substance abuse amongst youth. And so along with that, only 8% of school administration actually use evidence-based substance abuse interventions. So even though there might be programs available, they're not evidence-based or they're not being implemented in the first place. Furthermore, there has been a decline in participation for these programs. So we saw that in the past few years, there's been a 16% decline in youth participating in preventions programs entirely. Along with that, there's been a worryingly minimal policy focus at the statewide level, which means that local governments and health committees aren't really focusing on the issue of preventing substance abuse amongst youth. So as you can see in the graph, from a 2018 study by the National Institutes on Drug Abuse, teenage substance abuse by senior years of high school has only continued to increase, with around 60% consuming alcohol and 50% consuming illicit drugs.
Okay, so now we're going to move on to talking more so about policy specifics. So when we think about health policy at the national level, it's really important to understand the structure and responsibility of the federal government. So there's three primary functions that it carries out in the healthcare space. First of all, it provides healthcare coverage through programs like Medicare and Medicaid, as Joey described earlier. Second, it funds and conducts research largely through institutions like the NIH and the CDC. And third, it serves a regulatory role. It creates and enforces rules in order to regulate patient safety, quality standards, and program accountability. And these responsibilities are also distributed across the three branches of government. So the executive branch is in charge of overseeing federal health agencies and ensuring policy implementation. The legislative branch is in charge of funding. It determines how much funding programs receive and passing the laws that shape them. And the judicial branch is more so a reactive role in this process. So it helps interpret laws and ensures compliance with constitutional standards. Um, so despite growing awareness regarding healthcare issues, change itself is not easy because structural change remains difficult. This is due to a number of systemic barriers. So interest groups and lobbying often influence policy decisions in ways that don't always reflect public health priorities. And additionally, compromise, although it is necessary in policymaking, it can lead to very vague and diluted reforms that might not go far enough. And complacency might actually be the most concerning, because when people feel like nothing can change, they disengage. And when you disengage from the system, nothing gets done and it slows progress even further. However, all those factors doesn't necessarily mean that change is out of reach. In fact, young people are often at the front of like impactful movements today. So some ways that you can get involved are volunteering in local campaigns that prioritize health equity, initiating or supporting community-based awareness projects in order to highlight gaps in access. And then you can also form youth-led policy coalitions, which are spaces where students organize and advocate for changes at the school board, city, or national level. And I know many of you guys are in these types of spaces already.
I just wanted to add something. So while lobbying can be harmful to a lot of public health initiatives with large industries, like pharmaceutical industries and insurance industries, donating large amounts of money to representatives to buy them out, for example, lobbying also presents like lobbying also presents like a great opportunity. Students, adults, I know that SBHA has their own lobbyists working with congressmen and senators, governors to help work around school-based health. And so I think that while it is crucial to understand both the pros and the cons of lobbying, you have to be able to see that both sides use it to their advantage to try and make a case for how their initiative would be helpful. And so I think the School-Based Health Alliance is a great example of using lobbying as a force of good.
Exactly. I agree with Joey in the way that it's all about getting your ideas out there as long as you guys work towards that goal.
So we talked a little bit about issues, financial struggles, substance abuse, also slightly discussed structural issues maybe within government that make it difficult to create change, but those same structural issues are things we can take advantage of to try and push change. One main way we think is a very strong form of advocacy is through HBHCs. So next slide. There's two ways that SPHCs can help. Before understanding that, I quickly want to talk about how SPHCs even work. How do they get money? How do they function? So the best way for a health center to actually perform properly over, 10 years is through having a constant funding base. They need constant money to take care of things like rent for their area, staffing issues, different things like that. And there's two ways that they can get funding. One is through federal means of funding. So one way that happens is through something called FQHC sponsored centers or federally qualified health centers. How this works is that school-based health centers can get funding directly from the government and federal agencies. For example, the HRSA provides funding to school-based health centers to allow them to function. Another mechanism that federal governments use is Social Security Title V. The best way to think about this is the federal government provides states block grants, which is just a hump of money that states can use. Specifically, this money is being able to be used for things like child health care. How can states best help maternal mortality rates and help reduce and minimize those? So one way that states use this money is through funding school-based health centers. So that's a great way that states can use that money. On the state level, states are able to partner their school-based health centers with existing programs. States have had, Medicaid programs, CHIP programs since the 1960s. One thing that school-based health centers can do is directly partner with those programs. And what that does is if Medicaid can authorize health centers as an actual provider of Medicaid and healthcare delivery that Medicaid provides, then it's a lot easier for health centers to be successful. There's no authorization forms that they need to sign. There's no specific additional bureaucratic things that they need to go through. People can get specific unique Medicaid numbers. So that makes it a lot easier for health centers to function. Now, specifically talking about how this funding can help resolve the two issues we discussed. First one with financial struggles. One thing that health centers can do, number one, is obviously provide healthcare at a very accessible means. Instead of families, trying to find a separate area to get their healthcare services for their child, the child has access to healthcare within the school center. Most school-based health centers are found within the school. I believe the number is around 92%. And another way that health centers can help is through helping people register for insurance. Health centers won't give you free insurance necessarily, but the staff in those health centers can help you register for insurance, help you through that process. A few health centers actually have legal support where families can go to these health centers to figure out that process, see if they need any legal relief to figure out those certain things. So health centers can, one, help with that financial issue. The second part in terms of substance abuse is a new program called ESPERT. These are essentially prevention programs that are implemented into health centers. And what they do is two things. Number one, they have universal screening throughout the whole school, so every student can get screened to figure out if individuals are susceptible to substance abuse or already undergoing substance abuse or need help regarding that. And the second thing that ESPERT programs do is they can refer treatment. So an individual can go to clinical services in a health center, figure out that they do have certain issues that they need to resolve, for example, substance abuse, and then the health center can send that student to a specific referral for treatment. And the reason why this is so effective is because there's a lot less stigma when it comes to going to these school-based health center drug prevention programs. For example, there's a statistic that indicates that students are 21 times more likely to go to a school-based health center than their local community health center because of the lower stigma and the easy accessibility. So all those things combined make health centers a really prominent solution when it comes to resolving things like financial struggles and substance abuse.
I wanted to add another note where school-based health centers help to resolve a policy issue. That's with that mistrust. By forming a strong relationship with doctors and other healthcare providers from a young age, whether that be through elementary school and middle school or even high school, there's a much stronger bond between doctors and youth and eventually adults. And I think that by having that constant care, you have much better preventative care at the same time as creating a much stronger trust between the community and the government. Or sorry, the community and healthcare. The healthcare is actively within the community as they are in the schools, as Rakeel was saying. And that means that they're able to act as a partner and act as a member of the community, helping to improve that trust issue that I mentioned earlier.
I'm not going to dwell too much on these numbers, but these numbers kind of just tell you where funding comes from. So figure one, most SPHCs are sponsored through health centers, i.e. the example I provided with the FQHC with federal funding. Figure two kind of shows you that a lot of money that SPHCs get is from billing, which means insurance billing. A lot of reimbursement rates that health centers get under Medicaid are a lot higher under health centers. So they get their money through that. There's federal governments. You can have local hospitals that provide some of their money to health centers to support it. SBHA, the School-Based Health Alliance, has its own third-party sponsors that create specific programs. For example, the NBA is sponsoring specific programs in the School-Based Health Alliance with their funding. So there's different sponsorships, there's different federal funding, state funding. So it creates for a diverse funding pool that health centers can work with to create constant funding and good healthcare for children.
And while SBHCs are very strong policy change makers and have a huge positive impact, it is also important to consider how big of the federal funding, how big federal funding is in it. As Rakeel was mentioning, there's Medicaid that has a big impact on how these SBHCs are funded. As you see in the chart on the right, the federal government pays a large amount to fund the SBHCs. And so I think it's really important to consider how Medicaid rollbacks and Medicare rollbacks, as well as cutting in different federal government situations, can affect school-based health centers. And I think that that's something that to keep in mind. While we know that these have huge positive health policy implications, it's important that we keep on fighting for them and that we keep on arguing to have the funding that they need to make that impact on the community that we know improves. So now we're going to talk about how your experiences at advocacy. Sorry, word mouthful. Now we're going to talk about your experiences advocating in health policy and how you have made a difference. If anybody would like to share their story or their experiences in advocacy, I think now would be a great time. Oh, feel free to just unmute. You don't have to like raise your hand and everything.
So I'm actually part of a national organization called Unity Consortium, which is basically well, I'm on their youth advisory council as well. And what we do is advocate for youth vaccination and kind of combating all of this misinformation about like the dangers of vaccines, because in reality, vaccines are a great way to fight disease. And there is also a lot of misinformation and mistrust in that area. So what we've done, I've only been with them for a short amount of time, but what we've done is we've really used social media. Um, I've spoken to like state legislators around the country, and we've kind of just been advocating for um, greater awareness. I think that's the greatest thing. And state governments can certainly help support that by um, by spreading real information and by making sure that um, trustworthy resources are being distributed everywhere so that people are just more aware of this like health resource.
That's great. Thanks for sharing. Does anybody else have a story about their advocacy work in health policy that they'd like to share?
I can talk a little bit about my work. So I think a few members of our council are also on this organization, but it's called Striped. It's the Strategic Training Initiative for Preventing Eating Disorders. So we're a public health incubator, and what we do is work with state legislators to push for a bill that will prevent the sale of over-the-counter supplements to minors, as many of these products are like directly linked to eating disorders, especially amongst young women. So like my work specifically has been creating like a coalition of youth in Ohio and a few other states that can meet with like legislators specific to that state about pushing for this bill. So it's been really interesting to meet with lawmakers and hear their perspectives on this bill, like from various different political backgrounds and political parties. But along with that, we've done things like get youth to sign on to a survey and then ask organizations for their support so that we can show legislators that like our bill has a lot of community momentum. So yeah.
I'd love to hear about how you got involved with Striped and how that process of getting involved in health advocacy and health policy was.
Yeah, definitely. So, for me, I just had like a personal interest in this field because I had like a lot of friends and like personal connections that were affected by this issue. So, I wanted to get involved specifically in the field of like eating disorder policy. So, I started looking online just for organizations that were doing work, and I thought like maybe I can just send like a few emails and hopefully hear back. So, I just sent emails to the people who ran the program, and I didn't expect to get a response back, but I did. And so like after, meeting the team and like getting oriented, I started taking more initiative, and then I kind of had more like ability to like create my own ideas and take more leadership on like creating a state team, creating a coalition of youth, and like contacting legislators and things like that. So it really just started with like personal interest and like shooting my shot at like contacting people.
That's so cool. Annabelle, if you'd like to share how you got involved with your advocacy experience, that'd be great too.
Sure, it actually started just I took AP Government and Politics this year, and just with the current landscape with politics right now, I have grown very passionate about it, and I especially in like with regards to healthcare. And I realized that even within my own school, like my peers were not like adequately educated on the benefits of vaccines. And I had this like almost debate with a friend about like some misinformation that they were just like spewing off about vaccinations. So I looked into like different organizations to try to affect policy with this regard because it's just something I personally care about. And I discovered Unity online and then I just applied.
That's great. Thanks for sharing. If anybody else has anything to say, has any stories that they'd like to share, stop me, but otherwise we're going to move on to the next slide. So now we're going to talk about our experiences in health policy. For me, I've primarily had experience in the legislative field. I worked with my county to create a bill regarding mental health and funding surrounding that mental health. During that time, it was immediately post-pandemic. And so a lot of my friends and a lot of people at my school were really struggling with mental health. And I was lucky enough to have had my county really, I guess, want youth initiative and youth involvement within their community. And so I was able to work with them and work with them as like a part of a program, the Youth Governments Project. And with that, I had direct connections with a lot of people in committees and a lot of people within the entire county board as overall. And within this, that meant I was able to talk with different professionals and people and politicians within the field, which allowed me to draft a resolution, eventually get it noticed by others and supported by others. And I think that that is what eventually allowed it to pass. For me, I think a lot of it was based off of luck as well as initiative. I think that the lucky aspect was that I was already involved with the county, and that meant that people knew my name and people knew that what I was making and that I had people that would support me. However, I think that the drive to create something that would help affect the people that were close to me and my community was also there at the heart of the legislative process. And so I think it's really important to take advantage of as many programs and opportunities that are offered to you as a youth and use them to try and get that lobbying, get that health policy across.
And then for me, I am very like involved with grassroots and a little bit into lobbying. You know, like for grassroots, it's more so getting involved in your local government, helping to further change there. So when election season came around, I worked with a lot of our local candidates in my city and in my county, who are running and campaigning, and I helped further their messages in my community, and I helped advocate for change. And then with lobbying, as mentioned before, I go to the University of Michigan, and at the University of Michigan, I'm on a panel of doctors, and I'm the only youth there representing like the university, like the students side of it. And with this group of professionals, we helped lobby the government for more initiatives regarding like youth health within the university. So that was really cool. And the way I got involved with that, it wasn't something that like they reached out to me and were like, oh, like, can you join this? It was more so me going to organizations that I was already a part of. Like, because the initial step is always you taking the initiatives to reach out to people who you know, and then they'll be like, oh, I didn't know you were interested in this. And then they'll connect you to people who they know. And then they'll be like, oh, we have a seat for you. Because a lot of the time you might not realize it right now. You might be little yourself and you might be like, oh, like I'm just like, you know, youth. I'm just like a really like young person. Like, what can I do? But a lot of people are looking specifically for that advice. Like for me, I was the only person under the age of 30 in that room. And that input itself was valuable for these organizations because they really want to hear your voice. So don't belittle yourself and don't put yourself down. That's really important.
My experiences, I think, are kind of a mixture of both. I've done a lot of legislative related things. One thing related to school-based health centers is I worked with a legislator in the Georgia General Assembly that's a physician, and we were creating a bill to increase funding for school-based health centers. Another thing that I was able to work on is specific to funding for greater health initiatives for childhood healthcare. So I worked with Senator Warnock's office. Warnock is a U.S. senator here in Georgia to increase funding for not just school-based health centers, but generally just get more funding federally to Georgia because of lackluster healthcare rankings in Georgia and in terms of education. So that's what I did legislatively. I also did a lot of lobbying work, just talking to state representatives, trying to build coalitions to talk to representatives. The biggest takeaway, I think, in terms of the experiences that I've had and what I heard from Joey and Muntaha is you need to take initiative to ask those representatives. If you have a local representative, a simple email, which is found publicly, or a phone number, if you contact them, they're more than willing to respond. The way I was able to contact my US senator here in Georgia was I just called the office and I got lucky enough that they responded to me through that phone call. So it was nothing, no fancy things, no, I had prior connections. Honestly, these people are your constituents. They want to respond to your needs. They're not responding to anyone else's needs, right? So just reaching out to them, taking that first step, they're more than willing to respond. Most of them are. And you can kind of build from there. Talk to them about issues you have, and that will build your own advocacy journey, get other students inspired, interested, passionate about that, and it'll just go from there. And one thing I wanted to add, Sahana was mentioning that she was working with Striped, that there's a same youth group, Stripe, that worked in New York, and it was just youth working on it, and they ended up getting that bill passed and signed by their governor of New York. So any small step always leads to greater change. You just need to take that first step.
And I really want to highlight how all three of these aspects, you could see how they're all very much connected. All of our stories kind of used aspects that we're seeing in like two different or multiple of the different parts of these three categories. And I think it's really important to realize how all this health policy stuff connects back to the school-based health centers. And I think it's most evident where school-based health centers use all three of these. I don't want to say tactics because that sounds a little like undermining, but like I think these strategies to push for better health for youth. And so like whether that means rallying youth like we are right now, talking to youth through a grassroots campaign of just connecting with them, or lobbying, which I know the School-Based Health Alliance does. And finally, whether that's through legislative work, like Rakil did. I think that it's really evident how the School-Based Health Alliance and school-based health centers utilize these three strategies to really push their health policy ideas that eventually end up eventually end up helping youth. And so as you can see, health policy and all these strategies can really be used for a positive force, and it's shown specifically by the School-Based Health Alliance.
Okay, so now we're gonna go into the policy simulation, and then the next slide should have some more instructions. Okay, so this is a simulation in which you guys are serving as a member of the Health Policy Task Force on your school's your state's School-Based Health Alliance Council. And the issue at hand here is that your state is facing an increase in rates of malnourished youth in low-income neighborhoods. So you want to be able to address that. And then as you can see here, the following goals, they're all bullet pointed, but the end goal here, we're going to split you guys up into breakout rooms, and you're going to be able to address the following health issue, which I mentioned previously, by drafting a policy that can address the causes and effects of the problem, like however you see fit. So what we're really looking for here is like, how do you think that you should handle this issue? Like, creative solutions are welcomed, and your end product here, the thing that you'll be presenting, is a resolution. It doesn't necessarily need to be super fancy. I know resolution can sound threatening if you're not used to the structure of that. It can just be like a series of bullet points just formulated to explain what your plan is and how much money you want to allocate to each thing. And you're also going to be assigned a budget depending on what breakout room you're in. So when you're in groups 1 and 2 will be receiving 5 million, and groups 3 and 4 will be receiving 10 million. And the purpose of this is so you guys can see and you guys can learn how like differences in funding can result in different outcomes.
Oh, not yet, Harper. 1 second. So here are some like examples, just to give you guys a head start. I know this sounds like really scary, and there's no pressure on this at all. No need to worry about it. And so here are some examples that I found online of positive health policy that help to deal with that issue of malnourishment and lack of food security. And so here are some 4 examples and how much they cost. And so based off your budget, you have to make a full plan to think about it. And although this is a very simplified health policy example, you'd have to keep in mind that there's other people that might disagree with your policy, or there's other people that might have counter incentives, such as lobbyists that are pushing for a different type of health policy. So I think it's really important to understand that this is a really big simplification.
So this is actually a sample of what school-based health centers have done to address the issue of food insecurity. So the National School-Based Health Alliance created a No Kid Hungry toolkit, which I think I can put the link in the chat if it isn't there already. But essentially, if you guys want to take a minute or so to explore, it's really interesting. It has some really good ideas for how school-based health centers have combated food insecurity within their own community. So the link is in the chat now. So feel free to use that as like an idea or like for guidance as you guys create your policies. But the website essentially has areas you can explore on things like sustainability, food insecurity and its socioeconomic consequences, how to like budget regarding food insecurity, and other things that local school-based health centers have done regarding this issue at a smaller scale. So yeah.
Feel free to like mix and match plans, combine a lot of the ideas together. The idea is for you to like see how a policy or how health policy might get like brainstormed and come up with and eventually pass. And so now let's go into our breakout rooms. I think some of us will be in there, so feel free to ask us questions. And yeah, we'll probably see each other back in like 15 minutes to do like some brief presentations. We're not quite done with ours yet, but that's okay. If you guys haven't finished, that's okay. We are gonna, sorry. Okay, I'm gonna share my screen and then if anybody, I think that our group would like to present, and if anybody else would like to present after us, feel free to. This is just like an example of how health policy would undergo and see what the process would look like. We haven't even finished ours, so no worries if yours is incomplete. And so yeah, I'll share my screen now. Can you guys see my screen? Okay, perfect. So the stuff at the top was our first like brainstorming or in our conversations of like, oh, what did this process look like? And Angelina brought up a lot of very important concepts along the lines of like produce and how malnutrition is not just based off of food insecurity, or food insecurity doesn't always just mean that there's a lack of food, but also a lack of quality food and the nutrition that students and youth need to grow and be healthy. And so I think that we really tried to target those aspects. We were lucky enough to have a much larger budget as some states and some programs do. I think that was supposed to symbolize how different groups might not have as much money, and so they might not be able to have as fulfilled or as comprehensive programs that other groups might, just because of the lack of funding and the difference in the amount of money that's put into the program and put into the initiative. And so in this policy idea, we tried to frame it as kind of a resolution, and it looks a little messy right now because we're not done. But the general idea is that we wanted to target this lack of proper nutrition. And so the ways that we were thinking about it, we just chose a random state like California. The way that we were thinking about it was to address specifically, or to make it as efficient as possible. Specific students might have specific nutrition needs and might not have access to specific things. And so we thought it was best if the school-based health centers that were there already could take advantage, or could be used to figure out what was needed from students to students. If certain students are lacking in specific vitamins, and whether that be like vitamin C or vitamin D, and they needed food that was high in that quantity, we would draft specific toolkits for them to be given to them, where they would check in with it using like a prescription program. My friend has told me about prescription like food programs, and using a similar idea, we would have students have prescriptions that would target specific dietary needs, and those would be the food kits that they would pick up. That way, not everybody is forced to have the same food kit, and not everybody needs to have, like, we don't need to have food kits that check every single box if we know that X people need a food kit that targets this box. And we thought that would be more efficient and would be more cost effective. And so it'd be much better to target individuals. And so at the bottom, we have some budgetary allocations, rough estimates, of course, because we don't have like real numbers. But so it'd be around like $115 for a person to use this program to start off with. That includes like the screening, the initial screening, and the different ways to access and evaluate what nutrition that they need. And so I know this looks really messy and it's not like completely full-fledged, but this was just like to give a basic idea of how, with a specific budget, there's a lot of things that need to be taken into account with health policy, and how there's a lot of creativity that can be used to make a very efficient program. And I think that, again, this was very simplified because in the real world, we'd have to worry about budgets. We'd have to like getting a budget, not just getting given a budget. We'd have to worry about lobbying. We'd have to worry about more disagreements between individuals. And so there'd be so many different things that have to be taken into account. And so here is our resolution. And I know it looks messy, but it was like a good 20-minute resolution. So if anybody else would like to share their version, that'd be great.
I think our group can present. So we don't have like like a template like your group, but we took a bit of a broader approach. So I can start. So Charlasia, Comfort, Annabelle, and I talked about obviously the problem, which is the state facing an increase in malnourished youth in low-income neighborhoods, and our budget was $10 million. So we bucketed into a few solutions. First is solutions that can be addressed through SBHCs. Second were solutions that can be implemented on a community or city level. Third was solutions for state investment. And then the last solution was for advocacy. And I think Annabelle can go a bit deeper into each of those buckets.
Yes. Did you want to share your screen, Nikhil?
Yeah, I can share it.
This is for that one.
So for SBHC specific, we decided on food pantries and food stamps. So like in this school-based health center, they can provide food stamps for people to use. And then for community specific, we were thinking community food drives where everyone can contribute some like canned food, and community gardens. And for the community gardens, I guess people would collectively grow healthy, nutritious food. And then for state investment, the state would invest in free school lunches and grocery stores in food deserts. And then for advocacy, the state would support educational campaigns on nutrition and maybe how to grow your own food, and social media advocacy to spread awareness about the state's issue and potentially get support from even other states or just people across the state. And then we also accounted for other unexpected expenses and flexibility. And then Carlasia and Comfort can talk about why we chose to budget or like allocate the amount of money to each segment.
Okay, so out of our 10 million budget, we decided to assign 50% of the money to state investments, and both of our community Pacific and our advocacy, we decided to give the lowest budget of $500,000.
And we also left out 1 million for unexpected expenses and like flexibility for like marketing and like supplies and things like that.
Awesome. Thanks, everyone.
Was there one more group that was divided up, or two more?
Yeah. So I was
Okay.
Jisoo, do you want to go or do you want me to go?
You can go.
Okay. So
Sure.
I'm group one. Jisoo and I are from two different groups, so we're not the same group. So for group one, the budget was 5 million. Actually, let me try sharing my screen. That might be better. Okay, can you guys see that? Are you guys able to see my screen? Or
Yes.
okay, sounds good. Okay, so our budget was $5 million. And so we also didn't have like a super formal like Joey plan, like with a template and all, but we did the best we could in the time we had. So we tried to focus on two different things. We tried to focus on getting food immediately to the kids who needed it, and we also tried to focus on like building sustainable forms of um building sustainable like resources in the long term as well. So it would help if we had more time to develop this. But so we want to start off with, we had 20 food pantries. So the things in yellow are the things we had, the things in green are the money that we like allocated there. And we had 20 food pantries. And if you're not familiar with the concept of food pantries, like I go to the University of Michigan, and at UMich we have like this isn't like I feel very privileged to be in this position, but we have a grocery store and it's just like walk in and it's completely free, everything in there, and you just scan your student ID and you can get whatever groceries you want. So all food pantries don't run like this, but many of them do run similarly where you can just walk in and grab food without having to be questioned about your financial eligibility and all of that, which I think is really cool. So everyone who needs food can get it. So we had 20 food pantries, and then we had a backpack program, and this was something that wasn't mentioned in the things that like the slides gave us, but more so Corey described it based on her own experiences. So Corey, do you want to explain more what that is?
Yeah, so the program is something that we have in place in my school, and specifically in Arkansas, it's statewide. And so it basically just provides our students who qualify, which everyone in my school district qualifies for it because we're so low income, 2 weeks worth of food per week. And this is per child, it's not per household. We have it marked down there. So it's not like you're getting 2 weeks worth of food per house, but you're getting 2 weeks worth of food per child. Um, this is also stuff that isn't necessarily for school. Like all of this food is for home. All of this is for after school and like for your weekends and every time that you're not at the school. Um, and we have our money. It's about $50 per bag. That's really a rough estimate because at Magazine, most of our food is donated, and so I don't really have like a hands-on experience with the budget for that. And then we put 10,000 or we put $500,000 worth of food or like money for the food bags, which can provide 10,000 kids.
Yeah. Thank you, Corey. And then we also had two nutrition education programs, which, you know, that's more of a self-descriptory name. They seek to educate kids about nutrition. And that's also more of a long-term thing, you know, to build connections, to strengthen, you know, like everything to help people understand, like, okay, like here's some things I should be eating that's better for me, and here's some things that I shouldn't be. Because I also grew up in an area where there's a lot of food deserts. And if you don't know what a food desert is, it's basically typically in low income areas where like things like Whole Foods and Trader Joe's, which really have like a lot of like organic, very healthy options, there's not a lot of that due to like a lot of those companies not wanting to invest in those areas due to socioeconomic concerns, being like, oh, like these areas won't like give us a lot of buy-in, you know. And because of that, a lot of food in these low income areas is more so like extremely processed, and you won't find a lot of like organic produce and stuff. So if you really want to eat healthy, you really, really, really have to go out of your way to find it, and it'll be like a huge hassle to do that. So these nutrition education programs are to help address that and to help people understand like, okay, this is what's good for me and what's not. And then the school gardens are also more of a long-term thing as well. So like that grows produce and then kids can take the produce home, and then it's more so self-replenishing. So we thought that was a good investment. And then for the school meals, we did allocate the rest of the money there. But that was more so because of timing issues and not because we couldn't think of anything else, because it was like 2 minutes left on the clock and we were like, oh, we have like a lot of money left, so what do we do with it? So that's just where we allocated everything else, but if time permitted we would have done more creative options, I'm sure. But with the amount of money that we had, around 1,000 kids would be getting free lunch for a year, and this amount for 900 per kid per school year, all their meals for the school year would be paid, but the 900 amount, we just searched it up. So that's just where we got it. So it could be varied depending on where you're from. But yeah.
Sounds good. sorry to cut off the last presenter, but it is 12:13, and I think it's around time that we wrap up this presentation. I really wanted to thank everybody that participated and worked alongside us, and we really appreciate it. And I hope you guys learned a lot. So thank you very much for coming.
Awesome. Okay. Thank you guys. Thank you all to our presenters so much for leading us through that amazing session. We are going to be having our next workshop, Medical Technology in School-Based Health Centers, in the upcoming hour. Is it okay if I paste the registration link in the group chat? Or is that already in there? Okay, Harvard posted it. I hope you guys have a great afternoon or morning, depending on what time zone you're in, and I hope I see you in about 45 minutes. Thank you all for attending.
Thank you.